I'm Dr.Heena. Today, I know it's already late. Everyone must have been exhausted already, but I'm not going to take much time. It's a very simple and a very easy procedure. Uh, each and everyone must know this procedure, irrespective of their professional background. Without further ado, I would like to dive into today's topic, that is BLS. BLS is a basic life support, and today we are focusing more on cardiopulmonary resuscitation. I am going to tell you what is CPR, how to perform, and when to perform it. CPR is an emergency procedure usually performed when the person's heart rate or the breathing stops. It can be due to cardiac arrest, or it can also be due to drowning, and sometimes due to severe physical or a mental trauma. CPR is given specially to restore the blood flow to the more vital organs like the brain. Whenever there is a cardiac arrest, brain is the first organ to be affected. Within 3 to 4 minutes of the blood flow stops, the oxygen will be deprived and brain cell starts to degenerate. That's why we have to start CPR to take care of the vital organs like the brain. Before starting the CPR, we'll have to check for a few things. We are not sure when the person collapses, so we'll not be able to access the symptoms as well. The person may suddenly collapse anywhere on the road or anywhere. You'll not be aware of it. Like I said, we have to check for a few things. We'll have to check for the surroundings on which the person is lying. We have to check for the surroundings, like if there is any sharp object around, there can be some stones or a piece of glass. We'll have to check for the surroundings first. And also we have to check for the surface on which the person is lying. The surface should not be irregular or it should not be uneven. This is the first thing we have to check for. I hope I'm not so fast. Is this okay? This speed is okay? Yes. Okay. And the second thing we have to check is if the person is conscious or not. If the person is not conscious, we'll have to check for the pulse. Generally everyone will be knowing about the pulse, radial pulse. We are all aware of the radial pulse, but in this case we'll have to check for the coronary pulse. To check the coronary pulse, you'll have to just take one finger, the middle finger, and place it on the corner of your jaw. Then slightly get it down, at least 1 centimeter down. Then you can place your index finger. Gently press and you'll be able to feel the coronary artery pulse. You'll have to check for the pulse. If the pulse is very feeble, or if you'll not be able to trace the pulse, you can ask the person if he's okay. You can next check, tap the shoulders of the person, shake him and ask, "Hello mister, are you okay?" If the person still doesn't respond, this is the time when we have to start CPR. And before starting CPR, if we have someone to help us, we can ask the person to call the emergency number first. In India, the emergency number is
112.
112. That is for the advanced medical services. And you can also call 108 for the ambulance services. If you are alone and you have the access to the phone, you first have to call the emergency number, then start the CPR. Okay? And the CPR should be continued until the emergency services arrive. Is it clear till now?
Yes,
okay. Now I'm going to explain you about how to perform CPR. There are 3 major steps. I mean the 3 simple steps, and this simple steps it is given by an acronym CAD. The acronym is given by American Heart Association to keep us to make it easy and understand better. Everybody can easily remember these 3 steps. C stands for compressions, A stands for airway, that is airway opening, and B stands for breathing, that is rescue breathing. But the most important step is the compressions. We'll have to start the compressions. The next 2 steps are also important, but that needs physical contact with the person. Some people might not be comfortable doing that. They might be scared of contracting some infections, or they might all be scared of some contagious diseases because we are not aware of the person, what he is suffering from. But the first important step should be performed at any cost. To perform CPR, we have to place the palm, the foot of the palm, whichever palm you are comfortable with, on the person's chest. I'll show you practically a little later once we discuss all this. You'll have to place the palm on the center of person's chest. First, you have to make the person lie straight on the surface, and the surface should be firm. It can be either a table, or if the table is not available, it can also be the floor, not a problem. But the surface should be firm. You have to make the person lie on the surface, on his back. And next, you have to place one of the palm on the person's chest, on the center of the chest. Then you have to place the other hand on the first hand. If I say it is center of the chest, it will be easy to mark in the children and the this one male. But it will be a little difficult to mark in the females because of the anatomical structure. Then you have to look for the bone which we have, the ribs which are connected. This is sternal bone. You have to place the palm on the lower part of the sternal bone. You have to place the other palm on the first one. Then you have to interlock the fingers. Then you have to see that the elbows are straight. Elbows should be straight, and the shoulders should align to the hands. It should be like a perpendicular. It should be perpendicular. It should not be slant. It should be straight. After this, you can gently, you have to push straight inside the chest. It should be 5 to 6 centimeters deep, around 1 to 2 inches, around 2 inches, not more than that. It should be 5 to 6 centimeters deep, not more than that. And you have to wait till for the chest to spring back or to recoil back before giving the second compression. Okay? And this way, you have to give 100 to 120 compressions a minute. Okay? It should be very fast. You have to continue doing this. And after 30 compressions, there comes the second step. That is airway opening. Second step. After giving the 30 compressions, you have to go for the second step, that is airway opening. Now the person will not be able to open his mouth. We'll have to help him, we'll have to do it on our own. To do this, we'll have to place the palm on the person's forehead. This is also known as head tilt and the jaw lift maneuver. Okay, head tilt and the jaw lift. You'll have to place the person's palm on the forehead and gently tilt the head backwards. Down. Tilt down. And with the other hand, you'll have to place on the chin and slowly lift it. And if the person doesn't breathe, by this time the mouth opens, the airway is open. Even after this, after giving 30 compressions and opening the airway, even if the person doesn't respond or the chest doesn't move, we'll have to go for the third step. That is rescue breathing. Rescue breathing is generally mouth to mouth. But in cases of severe trauma or when the mouth doesn't open, we can also perform it through the nose. That is mouth to nose breathing. Okay. To do this step, we'll have to cover the person's, we'll have to shut the nostrils by one hand, the person's nostrils with one hand. And we'll have to lock the person's mouth, cover the person's mouth completely with ours, and we'll have to give a breathe. We'll have to breathe slowly for a second or two. Okay? For a second or two. After breathing into the person's mouth, if the person still doesn't breathe or doesn't show the movement or any signs of their life, you'll have to perform this second step again. By this time, the mouth may get closed again. Okay, so you have to do the airway opening again. Like I said, the head tilt and the chin lift method. Once again, you have to do that. And you have to do the second rescue breathing. If the person shows the movement of the chest, you need not perform the second step again. Okay? You can directly go for the second rescue breath. Even after this, if the person doesn't respond, you'll have to continue the compressions. 30 more compressions and 2 rescue breaths. 30 more compressions and 2 rescue breaths. So 30 compressions and 2 rescue breaths will make 1 cycle. You have to perform 3 to 4 cycles in 1 minute. This should be continued till the emergency help arrives or the emergency help takes over. So this is all about the adults. I hope this is clear. Is this clear? I'll show that practically you'll be able to understand better. And now this is for adults. Now for the children's and for the infants, it is going to, all the 3 steps are going to remain the same. But the only thing here changes is for the kids above 2 years of age, we can use one hand, only one hand to give the compressions. And other 2 steps remains the same. And if the child is of a bigger build, you can use both the hands. And for the infant or a very small baby, you can use just 2 fingers. 2 fingers you have to place between the chest and you have to give the compressions, making sure the hand is straight. You have to give the compressions, but here the compression should not be so deep. It has to be between 3 to 4 centimeters. The depth should be 3 to 4 centimeters. This is how you have to perform in the kids and the children, infants. Any doubts till here? Any doubts?
Ma'am, compression for children's, ma'am? For adult, you told like a 30 compression we need to give. For
Yeah.
children's?
It's the same. Everything is same.
But
Just
we
the
need to
hand and the
use
pressure what
finger.
you give is
Finger.
yeah.
Okay.
The hand for the kids and fingers for the infants.
Okay.
Compressions remains the same. Any doubts like why only carotid artery? I said it is because the blood flows. Yeah.
Initially you said you have to look for the surroundings.
Correct.
It shouldn't be irregular. I mean,
Correct.
what was that for?
Irregular in the sense the surface should be flat and it should be foam like this.
No, not when you make the person lie down.
Yeah.
First you see the circumstances why it happened.
Correct.
So that time you said it should be, I mean, look if it's irregular. I mean, how does it really affect? How does it matter?
The person may get injured when we give the compressions because we are going to give it very hard
Okay.
and we are going to give it continuously. So before that we have to make sure the surface is firm and the surface is even.
So do we also have to look why the injury or the particular thing happened?
We'll not have time for that. It is a very unpredictable situation and we'll not be able to make out it is because of heart attack or we'll not be able to make the signs.
You begin the scene
Yeah. If the person, this is to be started when the patient doesn't respond.
to your query or whatever.
Yeah, to what we ask, and if the pulse is not felt. Okay, if the pulse is not felt and the person doesn't respond, this is to be started immediately. And everything apart from this, let's see this practically.
Yes, ma'am.
Okay. Yeah, I'm looking for the surroundings. I'm going to do it practically. I can see that the surface is very clear and the surface is firm. And the person is lying here. We have made the person lie on his back on a firm surface. Now I'm going to ask the person, I'm going to first check for the carotid pulse. You can, it is actually seen on the mastocleidoid muscle here. If you lift it, you can also mark it like this and it is felt here. Or if you want to make it even more simpler, then it starts from the corner of the mouth, 1 centimeter like this, and you can straightly come down and feel the pulse. Okay? You'll have to check for the carotid pulse. I don't feel the pulse here. So I'm going to ask, hi, are you okay? Or you can also shake the person. Or you can loudly tap the shoulders like this. The person is still not responding. Now I'm going to start the compressions. And it is no hard and fast rule like you have to place either right or the left hand. Whichever hand you're comfortable, you can put it on the person's chest. So the center of the chest. Okay? It is actually, we'll have to, like I said, in the males and children, center of the chest falls near between the 2 nipples. But you can also, it is difficult in females. You have to look for the sternal bone. This bone. Here you will not be able to feel anything. You have to place your hand on the left bone. I mean, on the lower part of the sternal bone. You have to place your hand like this, and like I said, you'll have to put your hand like this. Then the hand, elbow should be straight. Elbow should be straight. And the shoulder should align to the hand. The shoulder should align to the hand. It should be like this. It's like we are not going to give the compressions by the weight of the arms only. We'll have to put our entire body weight, not just the weight of the arms. And next I'm going to put the other hand on the first one. We'll have to interlock the fingers. We'll have to interlock the fingers like this. Put it on the chest, and then we have to start the compressions. 1, 2, 3, 4, 5, 6, 8, 9, 10, 11. Similarly, we'll have to continue for the 30 compressions. Then you'll have to check if there is any sign or the chest moves up. If the chest doesn't move up, we'll have to go for the second step. That is airway breathing. I mean airway opening. Second step. CAB, CAB. Airway opening. In this step, you'll have to place your palm on the forehead of the person. On the forehead of the person. It is head tilt, and you have to gently tilt the head like this, downward and backward. With the other hand, you'll have to chin lift the chin. The mouth will open. This is the second step. If the mouth opens, okay. If the mouth opens, you can directly give the rescue breathe. If the mouth doesn't open or if the person doesn't respond, you'll have to do this again. You'll have to do this method again. And that is after the first rescue breath. I think I'll say it again. After doing this second step, you'll have to put your mouth on the person's mouth. You have to lock the nostrils shut, and then you have to put the mouth on the person's. Cover it completely, and you'll have to slowly breathe in the person's mouth. It is like you are ventilating their lungs. Okay? You'll have to breathe in the person's mouth and see if the person breathes. If he doesn't breathe, you have to do the second step again. Head tilt and the chin lift. And you'll have to give the second rescue breath. If the person responds after the first rescue breath, you'll have to directly go for the second rescue breath. You need not do the second step, like airway opening again. Okay, got this? 2 breaths, 30 compressions and 2 rescue breaths is 1 cycle. This way you have to do 4 cycles, 3 to 4 cycles a minute. Yeah, 2 times. Yeah, we should not go very hard or with a lot of pressure. A slow breathe for 1 to 2 seconds only. And in case of children, will revise it?
They'll revive the patient.
If the patient revives, better. Good. If the patient revives. If not, we'll have to wait for the emergency services to take over. Till then, we'll have to continue. This is to maintain the blood flow, so that the other vital organs does not collapse. The more vital organs in the body are heart and the brain. To maintain this, we'll have to continue the compressions. And in case of
Response after this, then you have to keep on continue, or
you can stop. You can stop. For response in the sense, the person should start breathing. Start breathing. Breathing, and you'll be able to feel the very rigid shot. Yeah, carotid arteries are there on both the sides. It is there on both the sides. So, yes, ma'am?
once you start breathing, we should stop.
Yeah, we can stop. But still, you'll have to make sure to get him admitted to a nearby hospital as soon as possible. And in case of children, you have to use one hand, I mean the palm, and you have to give the compressions like this. Okay? In the infants, 2 fingers. Okay?